Hi, thank you for joining us for the National Addiction and HIV Data Archive Program webinar on drug use among young American Indians exploring the data. We have Randy Swaim, who's the principal investigator for this study, and Linda Stanley, who's a research scientist at the Tri-Ethnic Center. There's also myself. I'm a data processor for NAHDAP, and I'll let Robert introduce himself.
Hi, I am Robert Cho. I'm the data processing supervisor for NAHDAP.
I'll get us started with the agenda for today. First, we'll give you a little bit of the background of NAHDAP and the Tri-Ethnic Center. We'll give you some background of the study, including the history of the study, sampling method, the data collection, and confidentiality steps taken for making this data publicly available. We'll give you a little bit about the description of the public use files, how the study was processed, how you can find the study on our website, and other available resources we have for analyzing the study. There will also be a little bit of information about previous research analysis conducted and the future of the study. Finally, we'll have contact information for us and also leave time for questions at the end. So a little bit about NAHDAP. NAHDAP is a topical archive at ICPSR, which is the Inter-University Consortium for Social and Political Research. Our mission is to facilitate sharing addiction and HIV research data. Our archive began back in the fall of 2009 and we're funded by NIDA, the National Institute on Drug Abuse. In addition to providing data, we also help users with technical assistance, both on the data provider side and the user side. Now I'm going to pass it on to Randy with background on the Tri-Ethnic Center.
Hello, this is Randy Swaim. I'm director of the Tri-Ethnic Center, and I think we've already said it's a beautiful morning here in Colorado, and hoping it's a bit warmer where you are as well. We're really excited to have this opportunity to share our data with you. Wanted to tell you a little bit about our center for those of you who are not familiar with us. We are a research center within the psychology department at Colorado State, and actually the center has been in existence since the late 1960s. For a number of years we were known as Western Behavioral Studies, and then in 1990 when we got our first center grant from NIDA, we changed our name to the Tri-Ethnic Center because at that time our research focus was on looking at adolescent drug use among American Indian youth, Mexican American youth, and white non-Hispanic youth. We can go to the next slide. Yes, on the next slide here you can see our website, and there is more information about the center on the website. There is more detailed information about some of the studies we're going to be talking about today. Also, there's brief information about a new study that we're conducting that's about a year old now, which is an inhalant prevention study among American Indian youth. Also, there is information about our community readiness model. Dr. Stanley is in charge of that, and there is information including resources for training and assessment on community readiness. We can go to the next slide. We're going to be talking today about two sets of data that we recently submitted to NAHDAP. I should mention that we've been doing our studies since 1974. This is when we first began investigating substance use among American Indian youth. And the studies that we have conducted have been limited to reservation youth. They do not include urban American Indians. I think we're all aware, most of us at least anyway, that among the various groups of youth in the U.S., that American Indian youth have had the highest rates of use. and even higher among reservation-based youth compared to urban youth. Most of our data includes 7th through 12th grade students, and these are students who live on or near reservations and are attending schools that are either on or near reservations. For some years, there are also 4th through 6th grade students. We have surveyed the younger students in previous years, and I'll be talking about one of those studies a little bit later. Let's go on to the next slide. So as you can see, our study began in 1974. That was actually the very first year of NAHDAP, and NAHDAP has just been a great partner with us, helping us to accomplish this long-term project. And so, once again, what we'll be talking about today are 2 sets of data that go back from 2002 to 2013. And it's been important for us to be able to track these trends over this extended period of time. And what we've noticed is that even though substance use among Indian youth has been higher than other groups, some of the same national trends that we have observed over the years have also been occurring among American Indian youth. For example, there was a reduction, fairly substantial reduction around the year 1980. Well, not only was this true nationally, but it was also true among American Indian youth. So we were able to see that some of these global trends were occurring among most groups. Go on to the next slide. Beginning in 1974, Dr. Fred Beauvais, up to 2012, has been the principal investigator. I served as co-PI for a number of those years, along with other Tri-Ethnic Center staff. During the next 5-year cycle, for which we have applied for funding, myself and Dr. Stanley will be the principal investigators. Our field director currently is Sue Harness. She's trained as an anthropologist, and she's also a member of the Confederated Salish and Kootenai tribes. We also have data managers, data analysts, and other support staff. Go on to the next slide. I think Linda's going to talk about sampling.
Yeah, so as Randy mentioned, there are really 2 data sets here, or 2 groups of data that are for different groupings of years in this particular deposit that was made at NAHDAP. I'm just going to speak briefly about the most recent set of data first, and then I'll give you a little bit of information about the 2001 to 2006 data. As you can imagine, the universe that we are sampling from is significantly smaller than that's typically done with monitoring the future. Our sampling universe consists of schools that are on or near American Indian reservations across the country. And we've split the country up into regions, and we've used regions, a modified version from Matthew Snip, and you can find more information about that in the code book and in the materials that are available on the NAHDAP website. But what we attempt to do each year is to get a representative sample of schools from each of these regions. It is not always possible to do that because, of course, it's a voluntary survey, and you know, there's many other surveys that are going on out there. It's sometimes it's just not possible to get schools that want to participate, say, in the southeast or in the northeast, where we have a fewer number of schools. But the next year then we oversample in those areas, and what we are attempting to do is to get a geographically representative sample over at least 2 years, 2 to 3 years, 3 years at the maximum. So from 2009 to 2012, we sampled 33 schools, or we have 33 schools in this group of data. They're in 11 states with reservations, and as you'll see later on in this, those states are not identified in the data set, but the schools are identified by the region that they're in. 25 of those schools are located within the boundaries of the American Indian reservations, and the other ones are located very near where most of the reservation kids go to school. 28 schools were public and 5 were Bureau of Indian Education schools. And I just want to say a little bit more before we move to the next slide about the earlier data set from 2001 to 2006. There was actually, during this time, a specific aim of the grant where the American Indian kids that live in areas other than Oklahoma would be compared to the American Indian kids living in Oklahoma. And the reason for that is because Oklahoma is set up significantly differently in terms of it doesn't actually have reservations. And there's a number of other things that you can see if you look at some of our papers that talk about this and that analyze this data. They'll talk about the differences between these two groups of students. But in this case, if you were to go in and look at that data, you would see significantly more students from Oklahoma. And that was purposely so that we could make those comparisons. But again, for the other students that were not living in Oklahoma, we try to be as geographically representative as we could every year, given the fact that our universe of schools is relatively small and it's a voluntary survey. So next slide, please. The students are given the American Drug and Alcohol Survey, which was developed here at the Triethnic Center, and it asks a variety of questions, obviously about substance use, but also about risk and protective factors related to substance use, and about a number of other behaviors. For example, there are some violence questions, in that there are some cultural identification questions, and it's, you know, there's a lot of data there. There's a lot of questions, so it's actually kind of fun to go in and look and see what's there and what's available for study. The schools, when the schools or the tribes gave the IRB approval to do the survey, sometimes we work with the tribes, sometimes the schools work on their own, and especially those that are off of the reservations. So, but we did obtain IRB approval. Typically, as Randy noted, 7th to 12th graders. There are some years where you may see some younger kids in the data. All the students at the school present on that day of surveying were surveyed. Now, participation averaged about 80%. If you look at how many kids are enrolled in that school versus how many took the survey that day, it averages about 80%. The kids, we only had to obtain passive consent. So there was no active consent where parents had to sign forms. Rather, they could opt their child out based upon information that was sent home. There was also information in the local newspaper, other ways to receive that information, and then they could opt their child out in a number of different ways. And the surveys were given either by staff here at the Triethnic Center that have IRB training, or by school staff that also had human subject certification, typically from Colorado State University. Okay, next slide. As I mentioned before, there are some things that aren't identified within that database in order to preserve the confidentiality. So you will obviously see no student names that are collected with the survey. There are IDs where there's simply an ID for a student, but it's a random ID. There's no rhyme or reason to the ID. There's also no school identifiers, so you can't see what schools we have surveyed, and there are no state identifiers. And one of the reasons for that is because some states have very few reservations, and it would be easy to tell who those reservations were based upon the number of students in the school or whatever it may be. So there are no state identifiers. There are regional identifiers. And so if we were to survey a school in Montana, you would see for that school a designation for the region as Northern Plains. And again, that is explained in the all of the various data at the NAHDAP website. There is a community code. It is numeric only, and it can repeat because sometimes schools have participated more than once in our survey, and so you may see a community code for one particular year, and 3 or 4 years later that community code will show up again. There's also a unique location identifier. And that unique location identifier is there because a community or a school could participate more than once in this time period of data that is on the site. And the unique identifier is just simply the year plus a location number, a school code that we gave to each school. And so if we surveyed in the year 2002, that would be the unique location number would start with 2002. And if the school code that was given was 001, that would be tacked on to the end of 2002. And this is, of course, done so that folks can use multi-level modeling and other techniques to take into account the nesting. And so that's one of the things with the analysis is there could be nesting at the community level and there can be nesting at the school level. And as it says here, one community may have several locations because there's more than one school in that location. Now, for many of these schools or communities, you may actually have just one school that goes from grades maybe 7 through 12 or 8 through 12. Okay, next slide. And here's just some respondent demographics for these different data sets. As you can see, from 2001 to 2005, there was 10,846 respondents. And one of the reasons why there's more there is simply because of oversampling of Oklahoma. And so being able to compare between the Oklahoma and non-Oklahoma students. And then in 2009 to 2012, there's almost 6,000 respondents. Now, these are not all American Indian or Native American students. If you see at the bottom of this table, oops, if we could go back a slide. Thank you. You see at the bottom of the table where it gives the overall male and female numbers. It's about an even split between males and females. And about 52.4% of the total sample have marked American Indian, and 47.6% did not mark American Indian. The vast majority of those will be white, but not necessarily will have marked white. And so again, there's interesting analysis that can be done on differences between these Native American kids and the white kids in terms of how their substance use differs and how the risk and protective factors are related to that substance use. So these just give the grades and how many people or how many students took the survey during that time period. Randy, did you want to say anything else about this table?
No, I think that's it.
Okay, next slide, please. And here's the location of the respondents. The different regions are given over in that far left-hand column. So we have the Northwest, Northern Plains, Upper Great Lakes, Southeast, Southwest, and Oklahoma. And, you know, for the vast majority of American kids that live on rural reservations, you will see those in the Northern Plains, the Upper Great Lakes, and the Southwest. And so you will also see that reflected to some degree in the numbers, especially for 2009 to 2013. You will see in the data set from 2001 to 2005 for the Southeast, there's no students that were surveyed during that time period. And again, that's because partially there was a concentration more on Oklahoma schools. There's fewer students on reservations within that area, and it's a voluntary survey. And so sometimes we're just not able to survey in those areas. But you can see in that later data set that we do get quite a few students that were surveyed in that region. We chose from 2009 to 2013 not to survey in Oklahoma, and again, the reason is Oklahoma is set up differently. They don't actually have reservations, and we did so many more surveys in that earlier year of data. So if you have more questions about the regions, you'll be able to see that in the code book. Randy, again, anything you want to add?
I think you covered it well.
Okay, next slide, please. And I guess, Robert, this is yours.
So this is Robert again with NAHDAP, and I'm going to discuss some of the data set and the documentation and the work that we did upon receiving the deposited data from the Tri-Ethnic Center. Originally, as Randy and Linda said, there were two files that were deposited with us, the 2001 to 2005 data and then a 2009 to 2013 data set. Upon reviewing the files, we noticed that about 75% of the variables matched between the two waves of data collection. And so it was decided to combine these into one larger data set. So the data set now, I have written here 527 variables. It now contains 529 because just yesterday we created two variables that combined race, a combined race variable and a combined Hispanic variable. So if you have previously downloaded the data set, you may want to come back to the NAHDAP website and download it again to access these two new variables. The two of the documents that are provided along with the data set is a code book and a questionnaire. The code book contains sections of processing notes of things that we did here at NAHDAP to the file, more detailed information about the geographic regions that were just discussed by Linda, and a derived scales document that we'll discuss in a moment. The questionnaire file contains the parental consent statement that was used, a crosswalk that NAHDAP created, and the annotated questionnaires for each wave. So the derived scales document or section in the code book, these variables are not part of the data set, but the principal investigators provided this document so that people who use the data may recreate these variables so they can use them and see what has been used in the compared to Dr. Swain's research previously. And so these are free for you to use as you see fit, or to create your own scales, or to guide the creation of your own scales in your analysis. The variable crosswalk is something that we created here at NAHDAP to help users understand the relationship between the two files from 2001 to 2005 and then the 2009 to 2013 waves. The data set itself follows the order of the variables in the questionnaire from 2001 to 2005. If you see here in a section that only has right here where a question was only asked in 2009 to 2013, those are designated with the variable name starting with a V. And something nice that the Tri-Ethnic Center provided was an annotated questionnaire for each wave. This sample is taken from the 2009 to 2013 survey. And we can see here that they provide the variable names for each individual item that is in the data set. And so we can see here that using the annotated questionnaire from 2009 to 2013, we can quickly see that the variables from question number 15 in 2001 to 2005 are now question number 16 in 2009 to 2013. And we can see that the last question for number 16 is new in 2009 to 2013 because it starts with the letter V. Using the annotated questionnaire and the crosswalk together will really help users learn and understand the data file. I wanted to discuss briefly the processing steps that we took here at NAHDAP as we prepared the data for release. Identification of cases in 2001 to 2005 that did not complete one of the two questionnaires used. So there were two parts of the questionnaire in 2001 to 2005. And for those students who only completed one, those cases were coded as a -4 and then with the value label of did not complete blank form. So as mentioned earlier, it was the American Drug and Alcohol Survey that is used, but there was also a prevention planning survey portion, and there are variables in the data set. Version 1 will say who completed a form, the A9 form in 2001 to 2005, and there were 21 people who did not complete that. And then there were 190 respondents who did not complete the second part, the prevention planning survey. And that is variable PPSVERS1. In 2009 to 2013, these two sections were combined into one questionnaire. So this -4 code you will not see on cases from 2009 to 2013. And because originally variable names and labels were the same for both waves, but some of the question had actually changed. And so we see here an example of this, that in 2001 to 2005, the question was a yes-no. And in 2009 to 2013, it gave a scale of never, or for how many times. And so when the data came to us, the variable names for both of these variables were the same, and the variable labels were the same. As we merged the file, we needed to differentiate the two variables. And so in the 2009 to 2013 survey or file, we renamed the variable name to include an R at the end of it, and added the number or the word times at the end of the variable label to help differentiate. Up here is a snippet of the crosswalk where we see that multiple variables have had this done to it. And now I am going to turn the time over to Jai to talk about finding the data on our website and some of the other resources that will be provided when you access the data.
Hi, it's Jai again from NAHDAP. If you haven't accessed the study page already, you can go to the NAHDAP website. The link to the website will be available at the end of the presentation. And at the very top of the NAHDAP homepage, there's a search bar, and you can easily find the data by either using the principal investigator's name, which is SWAIM. You can use the study name, or you can use the study number, which is 35062 in this case. On the study page, you can find more information about the data. At the top of the page, you'll have the study title, the principal investigators listed, and a summary of the data provided. Next slide, please. If you look a little bit further down the page, you'll find that there's data sets available in many different formats. We have it available in SAS, SPSS, Stata, R, ASCII, and delimited. Next slide, please. If you scroll further down the page, you'll find that we have a resource for looking at related publications. Here you can search published literature that references the study data. And also, if you end up using the data for your own research, we ask that you please notify us at NAHDAP so that we can add your citation to our archive. Next slide, please. Scrolling further down the page, there's a variable search tool available, and this allows you to search by the variable names or different topics that you are interested in. Here, just as an example, I used the search tool to look at marijuana use, and when I do that, I find that there's a bunch of different variables that discuss marijuana use or are related to that topic. And then a handy tool that we have available is that you can compare some of these variables. So for this case, I decided to compare two variables, one on the way that people used marijuana, whether they ate marijuana or if they smoked it. So here the responses are either that they did not mark that they ate marijuana or they did mark it. So comparing these two tables at a glance, we can see that people who responded were much more likely to say that they had smoked marijuana rather than eaten it. For even further analysis, you can use the SDA tool provided by NAHDAP. You can find this under the Datasets heading on the study page. SDA allows users to run summary statistics as well as create simple reports and charts. Looking at this is like the home page for the SDA, and you'll see that a lot of the words are highlighted in blue and underlined. That indicates that there's help screens available. If you click on those, that can tell you more about how you use those different tools. On the left side of the screen, you can see that there's some book icons, and these show the topic headings for the different variables and ultimately a list of all the variables available. Here I've selected to compare the responses to those people who have eaten marijuana by a region using a stacked bar chart. So when I click to run the table, I receive this output. The table indicates that there are only 9.8% of all respondents that ate marijuana. However, the portion of respondents who ate marijuana varies considerably by region. You can see the percentage of those that marked that they had eaten marijuana in bold. And so if we compare the regions, we see that over 20% of the respondents in the Northwest region indicated that they ate marijuana, while only 6.8% of the respondents in Oklahoma ate marijuana. However, as mentioned before, the number of people who were surveyed in Oklahoma was much higher than in other regions, so there's more responses from Oklahoma. So this is just to give you an idea of how you might use the SDA tool. For an even more streamlined analysis, you can access the quick tables, which are also under the dataset heading on the study page. These were just brought online today, and they're intended to help users look at some of the key variables that we expect many people might be interested in. We have two sets of quick tables. One is on substance use by cultural involvement, and the other that's highlighted on this slide is on substance use by demographics. So here I've selected the one on alcohol use by demographics. And here you can see that I've looked at whether people responded that they've ever drank alcohol by gender, and this is only for the Northwest region. You can filter by different topics, by region, by year, etc. So just to take a little look at what I got out of these results, we found that there's a slightly higher number of females in this region that responded that they had ever used alcohol compared to males. So hopefully these tools will be useful to you. I invite you to explore the study page because there's a lot of different things on there, and you can feel free to contact us if you have questions about it. Now I'll pass the presentation on to Randy, who will share with us some of the analysis that has already been conducted using these data.
Yes, we wanted to share some of the work that we've done recently, and these are also presented on the website if you want more detail. And I think that Linda is going to talk about the first study.
Yeah, this first study was just published in this past year in Public Health Reports, and it looks at our data from 2009 to 2013. It compares that to monitoring the future data within that same time period for 8th, 10th, and 12th graders, and specifically it looks at ever use, last month use, and last year use. There we go. And one of the things that we know is typically you'll see American Indian data significantly higher in terms of substance use. But what we wanted to do is look at this by various substances and also look for patterns in the data and how that does differ by grade and by gender, or by grade and by ethnicity. So if we could go to the next slide, it's easier to get an idea of what the results are looking at this slide. And I would just like to thank Kathy Etz, if she happens to be on the phone now, for putting this slide together. This shows the differences between American Indian use and monitoring the future use for alcohol, binge drinking, marijuana, and cocaine. You'll see the blue is American Indian use, the green is monitoring the future use, and this is a last month prevalence measure. And what you do see is somewhat what we expect for alcohol and for binge drinking. You'll see that the American Indian use is significantly higher than that of monitoring the future for 8th and 10th graders. For 12th graders, that turns around. And one of the reasons for that is the very, very high dropout rates among these American Indian youth. But we're also exploring other reasons why that may turn around. For marijuana use, you will see very, very high rates of use for American Indian youth. The last month rates, for example, for 10th graders are 36.2%. While for the Monitoring the Future study, those were 17%. And those are troubling numbers because you see the differences increasing over time between American Indian youth and the Monitoring the Future youth. And finally, with cocaine, again, just as an example here, you get significantly higher use among American Indians, but that reverses in the 12th grade. Okay, next slide. This is just OxyContin and heroin use to give you another example. The OxyContin use is significantly higher for American Indian youth at all the 8 different grade levels, which is something that we did not see before with the other substances. So that, and this is for annual use because annual use was all that was measured for monitoring the future. Same thing is true for heroin use, significantly higher for the American Indian youth at all the grade levels. Next slide. The next article looks at how drug use rates vary by region, and this uses a little bit older data. It combines some data from earlier in the 90s through 2006. And if we can go to the next slide, what we can see here, this is an ever-drunk variable that we're looking at by gender, by grade, and by region. And right now we're just taking a snapshot of 1999. One of the reasons why we did that is just to make it an example, but also 1999 had a very good regional representation. And this is just our data now. We're not talking about comparing to monitoring the future. This is our data, and this is for American Indian youth. And you will see here that Northern Plains and Upper Great Lakes have significantly greater use or greater frequencies of ever being drunk, pretty much for all of these different groups. And that was a finding that we had for much of the data. If we move to the next slide, here we're looking at ever tried marijuana, and again, you're seeing higher use in Northern Plains and the Upper Great Lakes. Not quite as much of a difference as you get into those higher grade levels. But when we move to the next slide and we're looking at meth, then you see a different pattern, and in this particular case, the Southwest has a higher rate of ever trying meth than the other regions. And in all of these graphs, the purple is Oklahoma, and you can see that Oklahoma is significantly less than the other regions. And we discuss in the paper reasons why we might be seeing these differences by region. And in the paper, there's also, it was multi-level analysis, and we did more analysis by age, gender, and those interactions with region. Next slide.
Yeah, as we mentioned before, the majority of our work has involved 7th through 12th grade students, but wanted to give you an example of a study that we had conducted that looked at 4th through 6th grade students. And we make various types of comparisons in the various papers that we have published. Some of the papers, as the ones that we've just described, compare to monitoring the future. And then other comparisons are looking at ethnic differences within a particular region. For example, we have done several papers that have looking at American Indian youth and white youth who are attending the same schools. And we think this has been an important type of comparison because it allows us to at least partially control for some of the socioeconomic differences. Whenever we're working with American Indian students and white students who are attending the same schools on or near reservations, we know that they're subject to some of the same demographic variables. So that's been an important comparison, as well as those to monitoring the future. We can go to the next slide. This particular paper looked at the differences between monitoring the future 4th through 6th graders and our study. And you can see here we're looking at drunk in the last month. And so the blue line there represents the American Indian students, 4th through 6th grade, and the red, the national younger students. And you can see that the rates of use are substantially higher for the American Indian students. They range over these years, and this ranges from 1993 through 2004. The relative rates were anywhere from 2 to 5 times higher for American Indian youth. Now, if we go to the next slide, we're looking at the last month use of marijuana and the differences between the American Indian youth and monitoring the future, even more dramatic here. And there are differences that range from 5.5 to 13 times higher for American Indians compared to the national younger students. Go on to the next slide, an additional paper. What we've talked about thus far have been papers that have focused on epidemiology, but one of the things that we always do within a given data set is also look at some of the etiological influences to help us understand what are some of the explanatory factors that explain the ethnic, regional, and national differences that we see. We do know, of course, and I think we've already talked about this, that there is a substantially higher rate of substance use among students who drop out of school. So Dr. Bouvet and some of our other staff conducted a study in 2012 that looked at whether or not bonding to school would protect American Indian adolescents against the effect of peer influences. I think we're all very much aware of the very strong influence of peers on the development of substance use. So this paper was looking at whether or not bonding to school would help protect against the effects of peer influence. And so what we find is that, first of all, as you might expect, peer use increases risk for alcohol use among American Indian youth. But among those youth who were more bonded to school, this decreased their risk, particularly among the younger students. And bonding, however, did not protect against the effects of peer influence among 12th grade students. Once again, we think this has something to do with the differences between students who remain in school and those who eventually drop out. Go on to the next slide, and we'll talk about another paper. In the last data set, that is 2009 to 2013, one of the particular things we were interested in was looking at the normative influences among American Indian and non-Indian youth, and because we've seen that, particularly for marijuana, it's become essentially normative in these locations. And so we wanted to understand more specifically, does the normative environment differ for various substances between American Indian students and white students who are in the same location? We go on to the next slide. Once again, I might mention that on our website there is further description of each of these studies. Among 8th grade students, American Indian students reported having more peer models for alcohol and for marijuana use. And for marijuana use among 12th grade students, once again, males had less models for alcohol use. So once again, we think this is partially explained by the differential dropout rate among American Indian versus white students. Now, what we're talking about here is descriptive norms. In other words, the number of students who report having peers who they believe approve of use. If we go on to the next slide, we'll be talking about injunctive norms. And so we're looking at peer disapproval of use. Younger white students had more peers who disapproved of alcohol use compared to American Indian students. And for marijuana and inhalants, American Indian students had fewer peers, at least by their perception, that disapproved of marijuana and inhalant use. And this occurred at all grade levels for both 8th, 10th, and 12th graders. All right, if we can go on to the next slide. Taking even a further look at the effects of injunctive norms and descriptive norms, this particular paper looked at whether or not outcome expectancies would alter the effects of both descriptive and injunctive norms. And among both American Indian and white students, positive outcome expectancies, in other words, expecting that I would gain something from using, this amplified the effects of peer models. So we here have an effect where we have a interactive effect of a couple of risk factors, both peer influence and outcome expectancies. So for those students who expected positive outcomes from use, that increased the influence of peer influences. If we go to the next slide, we can see how this operated, particularly on, I believe this one was for inhalant use. So that gives you an idea of some of the type of work that we have done. Once again, we try to publish papers that are focused on epidemiology and then also look at etiological factors that may explain some of the epidemiological differences. Go on to the next slide. Look at some of the things that we're thinking about, and hopefully some of the papers that we've discussed thus far will give you some impetus for things that you might want to explore with these data. Here are a couple of the things that we are looking at exploring, and of course you would be very welcome to explore these as well. One of the things is school context. We know that among the various schools that we survey, in some schools they are heavily populated by American Indian students, as high as 90%, and other schools may have maybe only 30 to 40% American Indians. So one of the things that we want to look at is the effect of ethnicity. Does it matter whether you are a majority or a minority within your particular school or in your particular community? We have found this effect in some of our other data that Linda and I have published in our rural study, that being a minority in a community, regardless of your ethnicity, can increase risk. Another thing that we are particularly interested in and wanting to explore in a further round of funding is the patterns of initiation rates. We know that American Indian students initiate substances at earlier rates compared to white non-Hispanic youth who are residing in the same locations. And we're wanting to understand better what are some of the factors that predict those earlier onset of substance use. Another thing that came up in some of our past study is looking at differences in parent-child communication about drugs and alcohol. And we have found that it appears from some at least preliminary analyses and prior data that American Indian parents, at least by the students' perception, communicate messages differently to American Indian girls compared to American Indian boys. And so that's another factor that we want to explore further. You may be hearing our 12 o'clock train, so maybe we'll wait until the train goes by. Won't take too long. And then another thing that we're wanting to look at further in the future is the relationship of delinquent behavior to substance use. We can go on to the next slide. We have the next slide. You want to talk about these, Linda? Oh, okay. Well, one of the things that we are wanting to do in the future, we are planning on developing a closer match of our study to the Monitoring the Future study. You'll notice if you look at our variables, they already very closely match both the style and the wording of Monitoring the Future, but we want to make that an even closer match in future studies so that we can make even more direct comparisons. We're also wanting to explore some of the regional and community characteristics, even though we know that there's commonality among some of the demographics among American Indian reservations, there's also variability. So we want to look at factors like employment rates, the influence of gaming, and then also to look at other factors such as historical loss, trauma, perceived discrimination, and ethnic identity. And we'll go on to the next slide. And part of our plans in the future is to begin a longitudinal study with 6th and 7th graders. Thus far, all of our data has been cross-sectional, so we're wanting to develop a longitudinal study that would allow us to look at some of these substance use trajectories and what their predictors are, and to also help us to better understand this pattern that occurs among students who remain in school and those who drop out. So those are some of the ideas that we are pursuing for the future, and hope that that spurs some ideas for things that you might want to investigate as well. So I think we're going to turn it over to Robert now.
NAHDAP is grateful for the opportunity we have had to partner with the Tri-Ethnic Center in receiving this data. It is unique in the nature of having such a large proportion of American Indian respondents. And so, as Jai mentioned earlier, just today we released 2 quick tables. and we will be working on additional ones in the future. We'd also like to start producing some infographics using some of the data from this study and maybe monitoring the future or other studies that we have, and putting up some different charts or graphs and information that link some of this information about youth and substance use together into a colorful presentation for people to use. And we hope that we will receive some more data sets from the Tri-Ethnic Center, maybe additional waves of data collection as they are made available and completed. So that kind of concludes the end of the discussion over the data set. To learn more about NAHDAP and some of the resources we have, you can watch another video that we did last year on YouTube about and there's a link right here that you can get to it when the slides are posted. And if you are on social media, we would invite you to follow us. Please become a fan and like our Facebook page or follow us on Twitter. We have weekly posts about upcoming events, new data releases, new publications, news from NIDA. No, we only do it about 1 to 2 times a week, so we don't bombard people, but we would love for you to become associated with us and follow NAHDAP. And if in the future you need to contact us, here is our information along with Dr. Swaim's information. So if you have questions on accessing the data from the NAHDAP website, using SDA, the quick tables, or just general data questions, please feel free to contact us here at NAHDAP. And if you have more specific data questions and or information that's not included in the public use files, then those should be directed to the Tri-Ethnic Center. At this time, we will take questions that have come up. I'm going to, excuse me, I'm going to read those off and then we'll get those answered. So, question number 1. It seems that by definition, all of the schools in the sample are rural. Is this correct?
I'll go ahead and answer that. That is probably the case for the later data set. The sampling universe is not necessarily all rural schools, but because it's reservation based, many of those schools many of the reservations are rural, and therefore many of the schools that are chosen or that are surveyed are rural. I believe if you look in the earlier data set, and especially for the Oklahoma data, you would see that there are not necessarily rural schools in there, that more of those would be urban. I don't think that we have a rurality code in the data set at this point in time. But if you use the 2009 to 2013 sample, those are rural communities. The next question, let's see. I'm just trying to find the question.
We've lost our question.
We've lost our question piece here. So,
there we go.
right, okay. So Sarah asked about, would this in fact be a school identifier? And I believe that probably had to do with U location. So there's a school code, a community code, and a unique location, what we call U location, that is a unique location number. So the community code identifies the community no matter what year it was surveyed. The school code identifies schools within that community, so you may have several schools in that community or only one. And the unique identifier, the unique location, is the year plus the school code. And so that one is unique to the data set, whereas the school code may in fact, it identifies schools, but you may see that in several years of data. You may see that repeated across the data set. And if I didn't answer that, let me know.
And there was another question by Bill about how bonding to school was measured. We have several measures in the data set that ask students how much they like school, how much they like their teachers, what their perception is of how their teachers feel about them. We also ask them about what kind of student they are. This particular paper that we were looking at school bonding, that comes out of one of our colleagues' research, Dr. Kim Henry, who has done a number of studies on the effects of school bonding. And it's possible that she may have included some other measures on that. I was not involved in that particular publication, so I don't recall offhand. But if you look at some of the school variables that are in our data set, you can see that the types of things that we have used in the past.
It looks like there's a question about would there need to be tribal approval to publish with this data. And in this particular case, we don't need tribal approval to publish the data. The data is always used in an aggregate form in terms of there's no identification of tribes. It's only identified by region. And through the process that we go through to do the survey, we are basically getting approval to use the data in our publications. Randy, did you want to add to that?
Yes, I mean, that's something that we are very careful about. We have been careful not to identify tribal affiliation, and that's something that we always assure the tribes that we work with that we will never identify or display results by tribe. And so it's always in the aggregate. I know that you may see in the literature some other papers that have referred to specific tribal groups, and of course they have gone through that tribal approval process to make sure that the tribe is aware, and it may even participate in some of the interpretation of the findings and the dissemination. I'm not seeing any other questions.
Yeah, there was one more, and I'm going to read that. Oh, okay. In the longitudinal study, could you include exposure to interventions, prevention, and/or treatment? That was asked by Judith.
Yes, I think that would be a very good thing to include. We will certainly take that into consideration. Appreciate that thought.
Yeah.
That is the end of our questions. So on behalf of Dr. Swaim and Dr. Stanley at the Triethnic Center and us here at NAHDAP at the University of Michigan, we thank everyone for their attendance today. We hope that you will come back to the NAHDAP website and access this data, use it, and publish more papers and information on this important topic and important segment of the population. And that concludes,
thank you.
Thank you all.
That concludes our webinar for today.